Come in.
Hello.
Hello.
How are you today?
How you doing?
Good. My name's Kylie. I'm going to be your nursing student today. I'm going to wash my hands up real quick. Alright, I'm going to be doing a head-to-toe assessment on you today. The nurse tech came in and took your vitals beforehand, and they were all within normal limits. Let me go ahead and verify your name and date of birth.
Corey Love, 10/22/73.
Okay. Alright, so they were all within normal limits. Did you use the bathroom before we get started?
Yes, ma'am.
And is the temperature okay in here with you?
Yes, ma'am.
Okay, alright, so like I said, the head-to-toe assessment, I'm going to start with your head. First thing I'm going to do is inspect your head for any lesions or infestations. And then secondly, I'm going to palpate your head, just to make sure I don't feel any abnormalities or masses. And I do note some alopecia. Alright, everything looks normal there. The skin is normal, or the temperature is normal. The skin is moisturized, it's not dry. And I don't feel any masses. Alright, next thing I'm going to do is go ahead and look at your ears. And again, I'm just going to inspect them first. And again, I'm just looking for lesions or abnormalities. Alright, I'm also going to look inside your ear for any discharge. I don't note any discharge in that ear, or any discharge in this ear. Okay, now the second thing we're going to do is look at your eyes. And they're both parallel. I look at like they're normally placed on your face. I'm going to pull your eyelid down and look at your sclera and your conjunctiva. And your sclera is white. It's not yellow, which would indicate jaundice. Your conjunctiva is pink and moist. Go ahead and open your eye a little bit for me. Alright, same thing for the top. Alright, now what we're going to do is we're going to check your pupils, make sure that they're equal and reactive to light. And what I'm going to do is I just want you to look at my chest, or find one spot to look at, don't look at the light. And I'm going to come from the side of your face to the, go ahead and open your eyes a little bit. And we're going to make sure that your pupil, don't close your eye. Okay, and that constricts. And that constricts. Okay, so your pupils are equal and reactive to light. Now I want to see if they accommodate. So what I'm going to have you do is look at the back wall, and then look at the back wall over my shoulder, and then when I tell you, I want you to look at my pen. Go ahead and look at the back wall, and now look at my pen. Okay, and they accommodated. So your pupils equal and reactive to light, and they accommodate. Okay, next we're going to look at your nose. Make sure that there's no lesions, the skin looks normal. Alright, and then I'm going to look in the inside. Your nose also looks midline on your face, which is normal. And when I'm examining the inside, what I'm looking for is that it's pink, moist. I don't see any lesions, swelling, bleeding, any abnormalities. Your septum is midline without perforation, so that looks good. I also don't note any flaring when you're breathing. Now I'm going to check your patency, and I want you to hold your mouth shut. I'm going to close one of your nostrils, and I just want you to take one breath in and out. Okay, one breath in and out. Okay, we'll do the other side. Okay, so that's normal. Okay, next we're just going to look at your lips. I'm going to inspect them, make sure that they're normal, they're symmetric, also midline, parallel to each other. They're plum in color, which is normal for African American. Alright, then I'm going to have you open your mouth. What I'm looking for now is that your buccal membranes are pink, they're moist, I don't see any lesions. I'm going to look at your hard and your soft palate to make sure that it's normal. Your teeth are clean and white. Don't see any problems there. Go ahead and open and say ah with sticking out your tongue. Your tonsils are normal. Your uvula is midline. I don't see any lesions, problems on the top of your tongue. Go ahead and raise your tongue up. No lesions. It's very vascular. Your tongue is a normal color, which is dull red. And I don't see any problems in there. Okay. Now what I'm going to do is palpate your sinuses. And I just want you to tell me if you have any, or you feel any tenderness as I press on your face. Okay. You feel any tenderness there?
No.
And how about here?
No.
With your maxillary sinuses? Okay. Alright, so everything on your head appears to be normal, symmetrical, and all your anatomical spots on your face are normal. Next I'm going to do is go to your neck, and again I'm going to inspect for any lesions or abnormalities with your skin. and your skin appears to be moisturized and normal, temperature is normal. Now I'm going to go ahead and palpate, make sure that I don't feel any masses. None there. Now go ahead and raise your chin up, and what I'm going to do is look at your trachea, make sure that I don't see any abnormalities or masses, and next I'm going to go ahead and palpate. And I'm also palpating your thyroid here, and I don't feel anything there. Okay, next what I want to do on your neck is listen to your carotid artery. And what I'm listening to is for a brewery, which would be a swishing sound, and that would indicate stenosis and or narrowing of your carotid artery. So I'm going to listen to that with the bell of my stethoscope, and I'm going to have you just turn your head slightly. I'm going to listen here. Alright, and I do not indicate a carotid brewery. It sounds normal. Okay, next I'm going to have you lay down, and we're going to do your anterior thorax. You can go ahead and lay back here. If you would remove your shirt, I should have told you that before you lay back. Okay, now the first thing I'm going to do with your anterior thorax is just look at your skin again, make sure I don't see anything abnormal other than a piece of fuzz. I don't see anything abnormal there. Alright, go ahead and take a deep breath for me. And then, alright, what I'm looking for there is just for your chest to rise and fall. And I'm also listening for your breath. You shouldn't hear, it shouldn't be very loud. And I'm just looking for symmetry to make sure your lungs are even on both sides when you take a deep breath in and out. And that appears to be normal. Okay. Now I'm going to listen to your lungs. I just want you to take a deep breath in and out when I tell you. Okay? 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 Again? Again? Okay. And again. Okay, so everything with your respiratory area looks good, sounds good. They're clear to auscultation. I don't hear any wheezing, rhonchi, or crackles. Alright, the next thing I'm going to do is I'm going to listen to all the valves of your heart and tell you where they're at. Okay, right at the sternum, at the second intercostal space, I'm going to listen to your aortic valve. Then at the second intercostal space, left of the sternum, I'm going to listen to your first pulmonic valve. Then your third intercostal space is your second pulmonic valve. And your fourth intercostal space is your tricuspid valve. And then around fourth or fifth intercostal space, left of the left mid-clavicular line is your mitral valve. And then last, I'm going to listen to your apical valve, which is left of the mid-clavicular line around the fifth intercostal space. And all of those sound good, which is also your apical pulse, is here where your apical valve is at. Okay. Also, I'm going to look at your chest to make sure I don't have any visible pulsations. I'm going to go ahead and palpate for any pulsations up here. And I don't feel any pulsations. Okay, next we're going to move on to your abdomen, and I'm going to inspect that again for any abnormalities on your skin. All the skin on your chest appears to be normal without lesions. And then next what we'll do is listen to your abdomen, and I'm going to listen to your bowel sounds. They should sound like gurgling sounds. And what I do is I divide your abdomen into 4 quadrants. I listen for gurgling sounds in each quadrant, and if I can't hear any, I should listen to up to 5 minutes. So I'm going to go ahead and start that now, okay?
Okay.
Alright, I hear gurgling in that quadrant. I hear gurgling in that one. I hear loud gurgling in that one.
Yeah, I heard that.
Just 8. I also hear gurgling in that one. Okay, next with the abdomen, I'm going to go ahead and palpate your abdomen. Have you had any tenderness or pain?
No, ma'am.
Alright, let me know upon palpation if you feel anything, okay?
Okay.
Again, we're going to do this in the quadrants. Any tenderness there?
No.
Alright, we'll move over to this quadrant. Any tenderness there?
No.
Here?
No.
Here.
No.
Alright, now I'm going to go ahead and have you sit back up. And we're going to do the back. And again, I'm just going to inspect your back here. Make sure I don't see any problems.